Hey guys, my name's Brian, and I guess this is our last assignment in pharmacology, so I'm happy to share this with you and um, hope you guys enjoyed the course. It's been a good course. So, we're doing teach the class, and so I'll just go ahead and start. So this is Joe. He's a 72-year-old Caucasian male. Smokes a pack a day, and he's in for his second appointment. So he already had his labs done, so that way we can look at him. Um, but he has a chief complaint of sinus problems. So he says, "Thanks for squeezing me into the office a few days early. I had my lab work done for my upcoming appointment, but I have this cold I can't seem to shake off. I've taken my allergy medicine for 2 weeks, but my face hurts and my nose is still runny. I can't take it anymore. Can you help?" So his current medications, he's on simvastatin, 10 milligrams. He takes it every night. That's a low dose cholesterol therapy. He's on finasteride, 5 milligrams Q day. Joe's a manly guy, so he's taking it for his hair loss and also his prostate medicine. So he's also, of course, takes Viagra. He has a prescription for that. And he's taken over the counter pseudoephedrine for nasal decongestion. So I'm just going to go back real quick, but he's saying that he's taking his allergy medicine. So it's just interesting to see what people are taking for their signs and symptoms. Anyway, we have his labs here. Everything looks unremarkable. Kidney function looks good. Sodium, potassium, magnesium, phosphorus all look good. And so then we get to his fasting lipids. And his total cholesterol is elevated. It should be less than 200 milligrams per deciliter. Kind of, uh, just to look to see the numbers. It's kind of a mid-range hypercholesterolemia. Severe is considered 500 or more milligrams. And he also, our main focus, I guess, as providers, I mean, you want the all around picture. But his HDL, or sorry guys, his LDL is 95, which you want that to be less than 70. So, I mean, that's, of course, the ones that everyone's looking out for. So, anyways, we're going to diagnose him hypercholesterolemia. I mean, he has elevated fats too. So, but we're treating cholesterol for, risk factors. And so basically, the way to do this nowadays is to use a calculator. I'm hoping this is on Cerner or whatever sort of technology we get access to, at our workplace. But so, anyways, we did his ASCVD risk calculation. And so basically, plug in the numbers. He's 72 years old. You put in his blood pressure, 147 over 85, his total cholesterol, HDL, and LDL levels. And at the top, you see his 10-year risk factor is 29.6%. High risk is anywhere above 20%. So he definitely has high risk for cardiovascular disease, um, so we're going to treat that. So basically, his risk is high, and so we're going to choose a statin to treat him with. So I chose atorvastatin, 40 milligrams every night before bed. And that, of course, is high intensity therapy, and is what's indicated for Joe. So during our assessment, we see he does have a little fever, 99.1, not really significant, but you know, just the numbers. His blood pressure is 147 over 85. This was kind of always a hard thing for me when we were going through the course, about what is the new, blood pressure recommendations. But other things that we're going to look at, his lungs are pretty clear. He's got some wheezes going on. He's got sinus tenderness upon palpation. He's got swollen cheeks, runny nose. So first off, we're going to look at hypertension. His blood pressure is 147 over 85, and he says that that's a little high for him, and that it's always high when he comes to visit the office, which we can look into white coat syndrome, or if we have any suspicions that he might be borderline, you could have him take his blood pressure at home, and write that. Anyway, so the new numbers show he is a stage 2 hypertension at 147 over 85. So the new numbers are 130 to 139 is stage 1 hypertension, or you're looking diastolic 80 to 89. And stage 2 is above 140. It's no longer above 160. So it's pretty, regulated numbers that we're looking at here. So, all right. So, hypertension, our goal is below 130 to over 80. And basically, we have 4 types of options. We have your ACE inhibitors, your angiotensin receptor blockers, your calcium channel blockers, and I don't think I said your thiazide type diuretics. And basically, the new guidelines, current guidelines, say that two drugs are better than one in treating hypertension. That you can start a patient out on one drug to begin with, but two is just gonna, for long-term outcomes, you just want to have a combined therapy. You can prescribe 2 drugs, individually, or you can use a combination type drug. So basically, I chose lisinopril with hydrochlorothiazide, 10 milligrams over, and 12.5 milligrams. It's an ACE inhibitor and your thiazide type diuretics, which are basically what you should be prescribing anyone that comes in with hypertension. So I basically chose lisinopril over captopril because you can take it once a day. They're just, cheap, good drugs. So, anyways, we move on to your chief complaint. He says it started a week and a half ago. He gets some seasonal allergies, and he started taking his allergy medicine, which of course is Sudafed. And I'm sure people do it, and it just all of a sudden seemed to get worse. So basically, we're going to have him stop taking the Sudafed. We're going to tell him that's a major contributor, or not major contributor, but you definitely don't want to take Sudafed with hypertension. You don't want to take I don't know. Sorry, I forgot. But anyways, any of the alpha decongestants, you don't want to mess with. Phenylephrine is what I was trying to think of. But so, anyways, we're thinking he probably has sinusitis, and we're going to prescribe him amoxicillin 500 milligrams TID for 10 days. So basically, this is the med reconciliation, amoxicillin, um, blood pressure medicine, your lisinopril and hydrochlorothiazide. We changed him from a low dose statin therapy to a high dose, 40 milligrams before bed. And he's still on his finasteride and sildenafil. Um, so, yeah, those are the new recommendations for hypertension, um, hypercholesterolemia, and that's it. So I'll post my questions on there, probably just in a Word document. So, anyways, I hope you guys had a great semester, and yeah, hope it's a good one. Thanks. Bye.